So that was Susan Collins, and those were her constituents making their discontent with the Republican senator from Maine heard loud and clear. That was the reception she got while attending a ribbon-cutting ceremony from the voters who've elected her to the Senate 5 times now. To be fair, those same Maine voters have never elected Donald Trump statewide. Maybe she should examine why that would be, that they'd be so unhappy. But we'll show you some places that actually have. This is Ohio, at Republican Congressman Warren Davidson's town hall meeting. That's a state that voted for Donald Trump by more than 11 points last year. We'll let you hear what his voters think of his vote on Donald Trump's signature domestic spending bill.
The big, beautiful bill is projected to take Medicaid away from as many as 500,000 people. How will you explain your vote to the people who will no longer be able to afford to see their doctor?
As I said early on, the only people who are losing access to Medicaid aren't affected in Ohio because we didn't add illegals to Medicaid coverage. And able-bodied working-age adults. And I honestly think most of them will still keep access to Medicaid because they'll probably get a job. Or they'll probably go to school. And lots of people are hiring, so I think most of them aren't going to lose anything. It's going to be great.
It's going to be great. Like, nobody thinks that's the case, that it's, quote, going to be great. Now, those voters were so done with him, they filed out while he was still speaking. But there's more. Like in the state of Alabama, where voters chose Donald Trump by more than 30 points in November. You want to hear what they had to say at Republican Congressman Barry Moore's town hall when asked about Donald Trump's tariff policy?
So right now, what we just saw in the report is that we haven't seen inflation at all. If y'all saw the report,
that wasn't the question. That wasn't the question.
So if there was inflation, you would see it.
Demonstrations in support of CDC officials who are resigning to protest the firing of the agency's director. This afternoon, the White House confirmed that President Trump has removed Dr. Susan Menarez as the head of the Centers for Disease Control and Prevention. Dr. Menarez's lawyers previously denied the administration's claim that she'd agreed to resign following clashes with the Health and Human Services Secretary, Robert F. Kennedy Jr. This morning, some of her top lieutenants were escorted from the CDC's headquarters after the announcement of their resignations. They include the CDC's chief medical officer, the head of its vaccine and respiratory diseases program, the head of the National Center for Emerging Infectious Diseases, and the CDC's public health data chief. All of this leaving America's public health agency without critical top leadership, and despite the fact that Dr. Menarez was nominated by the president, by this president. She was sworn in less than a month ago.
Look, what I will say about this individual is that her lawyer's statement made it abundantly clear themselves that she was not aligned with the president's mission to make America healthy again. And the secretary asked her to resign. She said she would, and then she said she wouldn't, so the president fired her, which he has every right to do. It was President Trump who was overwhelmingly reelected on November 5th. This woman has never received a vote in her life, and the president has the authority to fire those who are not aligned with his mission. A new replacement will be announced by either the president or the secretary very soon.
All right, our panel is here. They'll weigh in shortly. We're going to get started, though, with CNN's Elena Treen. She is at the White House for us. Elena, what more is the administration saying about this firing and the wave of resignations that's left the CDC leaderless functionally?
Yeah, we're starting to hear, Casey, from top White House officials and even the Health and Human Secretary, her Services Secretary, RFK Jr. today about this. And you're right, this move has left, we've seen now 4 top officials, 4 leaders at the agency resign abruptly because of the ousting of the CDC director. And kind of the through line from all of the comments we've heard from people at the White House has been, look, anyone at the CDC, the director, but also anyone else, really employees, if they do not share the president's vision, particularly when it comes to the Make America Healthy Again agenda, their jobs could be in jeopardy. And that's what Caroline Leavitt reiterated on the podium during the briefing. Take a listen.
If people are not aligned with the president's vision and the secretary's vision to make our country healthy again, then we will gladly show them the door.
Now, Casey, we did, like I mentioned, hear from RFK Jr. as well, the Secretary of Health and Human Services. And he said essentially, I mean, he was on Fox and Friends this morning. He didn't go deep into some of the details of this, saying he didn't want to discuss personnel matters. But he did acknowledge that he said if there's a deeply, deeply embedded malaise at the agency, we need strong leadership that will go in there and that will be able to execute on the president's agenda. But look, what I would be watching for is next week, we know that Kennedy is going to be before the Senate Finance Committee for a hearing. This is going to be front and center, and I think specifically from what we've seen is some of these statements from those 4 top officials at the CDC. They described a culture of censorship, communication failures, and the weaponization of public health by the Department of Health and Human Services. All of that likely to be a key line of questioning from some of these senators who are already raising concerns about this firing.
All right, Elena Trine for us at the White House. Elena, thank you very much. All right, I want to go now to Dr. Tom Frieden. He had served as the CDC director himself from 2009 until 2017. Doctor, thank you very much for joining us here. I'd like first for you just to tell us what your reaction is, what you think the implications are of the president firing the CDC director he installed after Robert Kennedy Jr. asked her to resign.
This is unprecedented. In the 80 years that CDC has been protecting Americans from health threats, there has never been a CDC director fired. But what's even more concerning is what is coming out about the reason, which is that Dr. Munarriz, who's a respected scientist appointed by the Trump administration, was being asked to do things that are not consistent with the facts. She was being asked to rubber stamp recommendations made without due process that would endanger the health of our children. This isn't about disagreement with the president's policies. These are individuals, the leadership of CDC. I know all of the individuals who resigned in the past 24 hours. All of them are dedicated scientists, doctors who have dedicated their whole careers to protecting Americans. This isn't about disagreeing with the goal of making America healthier. This is about standing up for Americans being able to understand how decisions about our health are being made and making sure that those decisions are made on the best available facts, not on some theory that Secretary Kennedy has been espousing. You know, what we've heard from the secretary since the day he joined is a series of false statements, things that are just not true about vaccines in particular.
So speaking of vaccines in particular, we of course had the new recommendations around the COVID vaccine that came out yesterday. How much do you think that had to do with it? And it does sound like you have some kind of nuanced understanding, perhaps have been in touch with some of these players. Which vaccine issues do you think specifically are driving this? I mean, what more can you tell us about that?
Really, just from all of the statements of Secretary Kennedy, we see the repeated statements of falsehoods. I will give just one example that hit me hard. When Secretary Kennedy announced that the U.S. would be withdrawing its support from Gavi, the vaccine alliance that has provided vaccines for hundreds of millions of children around the world and prevented millions of deaths. He recorded, this wasn't off-the-cuff remarks, he recorded a 3-minute video in which he stated multiple falsehoods, things that are deeply misguided, deeply misleading, and that are going to result quite possibly in kids around the world not getting the vaccinations they need and dying. In the US, if the advisory committee, the ACIP, doesn't recommend a vaccine, then a program called the Vaccines for Children program doesn't provide it. That provides half of all the childhood vaccines in this country. We're talking about the risk that our kids are going to be more vulnerable.
But the other reason why it's resonant for me is that at that moment, we were just about to head into the 2018 midterms. We were a little closer to the midterms than we are now. But all of the stuff that Trump did in 2018 around, if you remember, he closed on the caravans, right? Fear mongering about the caravans that were coming across the border. It did no good for Republicans in the House of Representatives. It did no good. There was a wipeout election in 2018, a Democratic wave. And I think this goes to your top point, right? Which is, as Matthew Dowd was saying the other day on the show when we were on, if you see anecdotal evidence, but you don't have data, you kind of discount the anecdotal until the data comes in. If you see data without the anecdotal evidence, you can't really measure the passion of it. You see that the people are against a certain thing, but we don't know how salient it is. You don't know how revved up people are. But when you see a combination of data that shows a thing consistently over time, and you see these kinds of things at town hall meetings consistently over time, where people are very fired up, very revved up. I mean, you could pick one town hall meeting and say, well, that was a bunch of Democratic plants. There probably have been a couple of town hall meetings that were mostly Democrats and not Republicans. But over time, when you see it over and over again, all over the country on the same set of issues, that also shows up consistently in the polling, you have yourself a reality there.
And plans are being crushed by you, the people. Whether it's regular folks at these town halls, basically saying, like, look, Donald, you could try to get tickets out to these events, but it looks like maybe one or two of them at most got to your actual supporters. The rest of us are here shutting it down. Or civil servants and their supporters protesting, walking out, basically saying that we don't support your decisions. We don't support your decisions to fire dedicated, nonpartisan professionals that follow the science. Right? It needs to really be made clear that most civil servants do not take political positions. Like the very top civil servants that are hired and fired on a partisan basis, like when a new president comes in, they're politicians effectively. Like the Secretary of State is effectively a politician, but the people that work under them are not. They are dedicated public servants, and whatever their political views are, you probably will never know because they keep it to themselves and probably their close family and friends. They're citizens with a right to vote, but they don't bring their politics to work. And especially at the CDC, they're there to try their best to keep Americans healthy and safe. And that's their goal. When it comes to vaccines and other stuff as well, they do the best they can to ensure that everyone gets the care they need in that regard. And they've done that with Democratic presidents. They've done that with Republican presidents. Maybe it's easier under Democrats than Republicans, but up until now, they have been able to do that job under previous Republican presidents. Not anymore. And that's why these are not these are not ideological people like me. They're not people like me. I've been to protests lots of times, right? These are people who want to go to the lab and get their work done. And they're forced to go out and protest and forced to shut down Trump's little narratives, his little rallying effort to rally the anti-science right, because they know that's their duty as scientists and patriots. And Donald's not going to break them.